Good afternoon, and thank you for joining us. I'm Kevin Kajiwara, and I am co-head of the geopolitical risk assessment firm Teneo Intelligence. And Teneo is very, very pleased and proud of its longstanding relationship with Concordia, and we congratulate them on their 5th anniversary. And this afternoon, the topic across the floor here is innovation and technology and how they are being brought to bear to change and innovate on a variety of topics. And the topic in this room today is on international disaster response. And I don't know if 2 weeks worth of UNGA presidential and papal traffic qualifies as a disaster, but I think that the Uber guys could have improved the technology on the GPS systems this past couple weeks. On a more serious note, though, I would say that we're in an interesting moment. Every month, another 1 million people flee their homes due to conflict or natural disaster. Really, not since World War II have we seen this on this kind of a scale. And we're seeing it related, of course, to natural disasters, earthquakes in Haiti and Nepal, hurricanes, tsunamis, but also pandemics, Ebola, avian influenza potentially, and of course war. Most obviously right now, the Syrian conflict and the ensuing refugee and migrant crisis in Europe. And yet the total budget for humanitarian aid is only $22 billion, and that is at least a third short of what overall demand is. So that as the needs are increasing, clearly the need to get scarce resources, whether they be financial, material, or human resources, into the theaters necessary where they are most needed, to do so efficiently, to do so transparently, and ultimately to do so with accountability. And I think that, as in so many other areas of business and in life and so on, technology is playing an ever-increasing role in the response to international disasters and helping us to facilitate disaster response, coordination amongst local and national governments, the international relief organizations themselves, and the private sector. So we're fortunate today to have a very distinguished panel of guests who are all expert on this subject and representing organizations that have been long-standing participants in humanitarian and disaster relief. And so what I would like to do is have them each introduce themselves and their organizations and talk a little bit about how they are innovating and how technology is being brought to bear to change the way they have responded and are responding to the current crises out there, and how that's ultimately adding up to a change in the overall protocol. So with that, first I'd like to introduce Michael Nyenhuis, who is here from AmeriCares, based up in Connecticut, but operating as a global health and emergency response organization in over 90 countries around the world. Michael.
Thank you very much, and very grateful to be here. Thank you for attending. As Kevin mentioned, we are a disaster response and global health organization, been around since about 1982. We respond to about 30 emergencies every year around the globe. The big ones you hear about, Ebola, Nepal, things like that. Smaller ones, Vanuatu, and others that you'll never hear about. We, I think, are probably fairly typical of NGOs in our space, in that we're just waking up to, I think, the power of technology to change the way we go about our work in disaster response, preparedness, post-emergency recovery work. I have just hired 3 months ago our first Chief Information Officer for our organization to elevate the role of technology and innovation into the organization, and he's beginning to work with all of our teams around the globe and different disciplines that we have to look at how technology can be integrated into their work. I think there are probably 4 areas that we're particularly interested in, that we're moving to a degree, but actually see great potential for. that we want to focus on. One of them is in the area of preparedness. We do a lot of disaster risk reduction work today, and beginning to see technology as a way, an important way in information gathering and data analysis work that's necessary to identify vulnerabilities and risks in communities. We have a pilot project we're doing in El Salvador, training local citizens in the use of simple technology on a tablet to do the data collection. And it's very interesting how that changes the kind of information you get back when you empower the local community actually to be the data gatherers and be able to do that for you as you look for vulnerabilities and risks in the community. So preparedness is the first thing. Coordination and collaboration, I'd say, is the second thing in the midst of a disaster in particular. We do commodity distribution along with other things in our disaster response, and this is always a huge problem and bottleneck in a major disaster especially. What commodities are needed, how are they coming in, where are they going? And we do a really good job of doing that with our local partners in a country where we work, but we don't do nearly as well of good of a job with other international NGOs that are also participating. And so developing systems that would allow us to have visibility into each other's commodities, our distribution networks, where things are needed, is a real need that hasn't really been addressed yet. Thirdly, I would just say that the issue of appropriate technology is critically important as well. We can get real interested in drones and other things, and we should look at those types of things. But most of the people in the countries that are going to suffer big disasters are on simple cell phones and text-based technologies. And the question is, how do we really maximize that use to use information from the local communities to be able to help identify where the needs are. And the last thing I want to mention is transparency to donors. And we're largely a privately funded organization. So our disaster responses depend on private donors, corporations, individuals, foundations, supporting our work. We need to both inspire them about that work and give them confidence in us. And part of that, the use of technology to get back to them information on what we're doing, the impact it's having, will go a long way towards driving more resources into our work.
Perfect. Thank you very much. Next to Michael is Rosa Akbari, and she's with the International Rescue Committee, where she's the Information and Communications Technology for Livelihoods Technical Advisor. Very interestingly, brings a wealth of experience in Africa, South Africa, and particularly the refugee camps in Western Sahara, but also has an interesting background from the U.S. Defense Department. And clearly, when we're talking about war-torn areas, potentially, there is oftentimes a key government or military component also involved that aid organizations have to coordinate with. Rosa.
Great, thanks. So I work for International Rescue Committee, as mentioned. We operate in over 30 countries at the moment abroad, as well as we have 25 resettlement offices within the states. We focus primarily on displaced populations and those who host them, and so people who are displaced from conflict, natural disaster. We do end up, as you see, many of these issues are cyclical, so we end up having country offices in places like Liberia, Sierra Leone for 10, 15 years. So a lot of the capacity building and everything falls on us. In terms of where our organization is, I joined last year. I'm the first of our entire organization to have the role that I have in terms of advising technology to our field teams as well as to senior management. What we're going to do with, let's say, digital payments is an area that we're quite keen on, but the difference between private sector partnerships as well as capacity building. I think that challenge that we've had is breaking apart those two things. Operationally, any of us can sit down and build a mobile forum and do data collection, this, that, and the other. The trick, how do we actually empower the people on the ground, local partners, as well as our local staff to take on those burdens? Similarly, from the private sector side, we don't need to duplicate. We need to be learning from the private sector and bringing in the technologies that they already have and applying it to our programs. And that's something that I've worked from the private sector to the Department of Defense. IRC is very candidly, we're learning as we're going, but the first step is always what's already out there and how do we bring it back and how do we learn and partner. And I've been very impressed and kind of renewed hope that, yes, we can actually work with the private sector. There are ways to do it, but we have a lot to learn in how we get that done.
Great, thank you. Dr. Eric King is a physicist who has made the move into public policy and is with USAID and has a role that not often is heard in terms of U.S. government organization, but is an innovation specialist there. Eric.
Thanks, Kevin. Yeah, I'm super happy to be here. I am a recovering academic. I left the world of academia and was also a nonprofit, a tech nonprofit founder for arguably what's the coolest job in the world. I work in the U.S. Global Development Lab, which is a kind of tech and innovation startup inside the U.S. Agency for International Development. So basically we're using technology and innovative approaches, including private sector partnerships, to apply them to the agency's mission, which is to eradicate extreme poverty. So I get to do all the nerdy tech things and then apply them to the most pressing and important problems that the world faces. And I really can't imagine doing anything more important or more fun than that. So as far as tech and innovation goes for international disaster responses, I come to this from a lens of spending the last year working on the Ebola outbreak in West Africa. And in particular with how tech and innovation can improve the way we use information to fight the disease in particular, but also to respond to international crises worldwide. And so I don't know if we remember back to last year, around this time last year, there were hundreds of new Ebola cases in West Africa every day. And what's scarier than that is that there were reports coming out from epidemiologists that the actual number of cases might be 2 or 3 times higher than that. I mean, imagine trying to fight a wildfire if you didn't know where it was burning. And this is, we're hearing themes about taking lessons from private sector, taking lessons from previous disasters, and the kind of changing face of disaster response. We have the most advanced tools in the world for monitoring natural disasters, the natural disasters themselves. We have, high-resolution weather satellites. We have global networks of seismic sensors. But increasingly, we're hearing a theme already that the emergencies that we're facing are complex, protracted emergencies with critical social elements. And these require, for us to get better information to the people who need it, require us to weave into those complex human fabrics of the emergency and response simple feedback loops that allow us to get information to the people who need it when they need it. And I can give, and this is where technology can really help. I mean, it's not a panacea, it's not going to solve the problems for us, but it can enable us to do our jobs better. And I can give 3 quick examples from the work that we did in West Africa. And so the first would be, we were using mobile phones to monitor at-risk individuals and households who had potentially recently been in contact with an Ebola-positive patient. And that gave us real-time information on where the disease might be spreading. We used simple text messaging platforms to communicate en masse with health workers across the entire region to make sure that we were prepared for the potential of infection to turn up at their facility, or making sure that people understood how to deal with the disease should they confront it. And we were using a combination of radio programming and SMS and hotline feedback to make sure that we were putting programming out into the communities who might be at risk for seeing Ebola that was adaptive to their needs. So we're making sure that we were providing information that people could use to protect their families and their communities from the spread of the disease. And all of these were geared toward preventing further spread of the infection. And so all of these were simple feedback loops that were woven into this complex fabric of the response that ultimately used technology that already existed. Most of these were using the phones that were already in people's pockets. And were designed by the users for the users to be geared toward action. So we're not just collecting information and funneling it up to the top of the decision-making pyramid, but making sure that the people on the ground who need information were getting that information. And these are some of the kinds of tech and innovations that we're really excited about in terms of improving the way that we use information to respond to international disasters. And it's these kinds of feedback loops that allow us to be adaptive and resilient to this kind of changing landscape of international crises. And then moving forward in West Africa, we're committed to rebuilding and building back better in West Africa, and that includes investing in the digital infrastructure of the region, and we're also committed, as Rosa mentioned, to learning from the lessons that Ebola provided, and some of the spotlight that's shown on the way that we respond to these complex emergencies, so that we can invest in between emergencies and doing things better next time.
Great, thank you very much. Richard Parker is the Vice President of Marketing and Communications at Project Concern International, operating in some 16 countries and dedicated really to communicating what the importance of global development and how that work is progressing. Richard.
Thank you. And I love that the topic is innovations of what we're talking about today, because innovation was at the heart of PCI's beginning. It was started 53 years ago by a physician. He had a nice cushy practice on Coronado Island off San Diego, but he started doing medical missions work in Tijuana. And he was called there late one night. There was a 3-year-old girl and her 1.5-year-old brother who were dying of pneumonia. Had no equipment or anything whatsoever, so he put together this MacGyver-esque oxygen tent for them, saved their lives. He saw the plight of children in the developing world, and Project Concern International was born that night. And as Michael just said, today we're in 16 countries around the world, still including in the U.S., and innovation is really at the heart of what we do, and our work is really to enhance health, end hunger, and overcome hardship. And the hallmark really of humanitarian assistance programs is really working with communities to be able to save lives, but also to save livelihoods. And that's really the key to all of the innovations and things that we have at PCI. And I'll just go through a couple of them that are really fun, one of which, thanks to my colleague here, that we've been able to do is really working with pastoralists in Ethiopia. There's a traditional pastoralist. There's 200 million traditional pastoralists throughout Africa, and Ethiopia in particular, due to climate change and due to droughts, then their traditional grazing areas are actually drying up, and they can't find green grass and shrubs for their flocks to be able to graze. And so one of the things that we did is we went in and worked with the development lab through some seed funding that they provided to us. And we created, and I always forget the acronym, Satellite Assisted Pastoral Resource Management, or our SAPARM project. And what we do is we actually take satellite data from the World Food Program and create these maps every 10 days to be able to give to native pastoralists, traditional pastoralists, so that they'll be able to know where to take their flocks. And so over a year period, we went back and did the study, because monitoring evaluation is really critical these days in global development, and also for anything to be able to demonstrate innovation. But we went back and looked, and over 2/3 of the pastoralists in the region where we were doing the pilot project had actually been using the maps, and herd deaths had been cut in half in just a year. And that's all thanks to a public-private partnership with USAID to be able to have the seed funding to be able to do it. And then Google was generous enough to be able to step in, and they gave us an additional $750,000 to really take it to scale in Ethiopia and also in Tanzania in some targeted areas. And then we're working with the lab again to be able to do some next generations of projects like this to really take it to scale on an even greater basis. One other one, we've talked a lot about Ebola so far, but one of the things that we looked at with our Ebola response was really, as we're fighting the current epidemic, how do we be able to prepare Liberia for the next one? What are we doing with healthcare workers there, with the healthcare system, to be able to strengthen it really during the process? And so we worked hand in hand with USAID and the Liberian Ministry of Health. They're actually elbow to elbow, since you couldn't shake hands during the Ebola crisis in West Africa, to really put together a response that was very locally geared, something that would be very responsive to the local needs that they would be able to understand. One of the things that we did was start managing one of the Ebola treatment units that's on the border with Guinea. In the Ganta region. And one of the things that we did was insist that the ETU be staffed 100% locally, because we wanted to make sure that healthcare workers there were ones that would stay for the long haul. And so we went through with really the doctors, the nurses, the just all of the psychosocial specialists that were there, the hygienists, to make sure that they were trained in infection prevention and control, and that they would then go out into the different communities and the different community health centers that were in the county region where they were, and be able to train them. So not only were we responding to Ebola patients there, but also using them as community health volunteers really throughout the entire county. And so by the end of the year, there should be in Nimba County, which was one of the hardest hit counties, with Ebola, they should have every health facility and every healthcare worker in those facilities trained on infection, disease, and control, so that if there is, God forbid, another outbreak, that the response will be much quicker. There's also the mobile technology that Eric had mentioned as well, and being able to get data from those facilities back to Monrovia. That was something that we were involved in as well. And we also have a lot of community health and nutrition programs there. And I think combined with the clinical piece that we were doing through the Ebola treatment unit and this community health advisor role that we were playing, we're happy to say that all of our programs, we are in about 750 counties, and they all remain 95% Ebola-free throughout the entire epidemic. And then one last area that I did want to mention, and the Sustainable Development Goals were passed earlier this week, and one of them actually for the first time was really talking about cities and how we need to really be paying attention to mega cities. It's a burgeoning problem within the developing world in particular. There's a recent study that said by the year 2050 that there will be 250 additional New York cities throughout the world. And the majority of those are going to be in the developing world. So after the earthquake in Haiti in 2010, we worked with USAID and the Office of Foreign Disaster Assistance, and also one of our partners, Global Communities, to be able to create, not just to provide housing, but not really to create just new houses out of the rubble, but to really create neighborhoods. We call this the neighborhood approach really with it. And so we went in not to just do housing, but to think about healthcare access for the residents to be able to have economic opportunity for education, for women empowerment. And so we were able to build a little over 600 houses in a neighborhood, one of the hardest hit areas of Port-au-Prince with it. And so that's something that you can do in a disaster situation, but we're also taking this now and using it in other countries like Guatemala to be able to do risk prevention. So how do we take areas in an urban dwelling that are prone to earthquakes or hurricanes and go ahead and start preventing and making the houses better for them, to be able to start putting in economic opportunity as well, to be able to have folks, to be able to have a thriving community that can actually survive and be banded together and can be safe from natural disasters and earthquakes and things that may happen in the long run. So I look forward to our discussion today and talking about innovation and all the ways that we're working to help people around the world.
Great, thank you, Richard. Dondi Mapa at the end brings an interesting and very different perspective to the table, representing, as he does, Microsoft. He's the National Technology Officer of Microsoft in the Philippines. Also, therefore, has the benefit of clearly being related to one of the greatest philanthropic organizations in the world, the Bill and Melinda Gates Foundation. But his products are clearly being utilized by everyone up here, well, when they work, Dondi. But also comes from a part of the world that has had no shortage of humanitarian crises and disasters, and has been brought to bear on that as well. So, Dondi.
Thanks for that comment. And I think what I'll share is how to make them work. That's right. Because as Michael and Eric had shared, the presence of information is a force multiplier when galvanizing response to disasters, whether it be like the epidemics, where you can gather patterns of infection, or in bringing in commodities. Right? How many times have we heard stories of a village where there's thousands of bottles of water delivered, and they're not able to consume all of that when just 2 kilometers away there's people dying of thirst. And that's because the lack of information on where to send those commodities, right? But as Rosa and Richard have shared, there's actually many tools out there that you can use, including tools from Facebook, Google, of course, Microsoft, Yahoo. Very easy to come up with these spreadsheets, put them on cell phones, tablets, and take them out. But the question is, how do we get them to work in times of disaster? And that becomes the bottleneck. And what I'd like to share is how we've put some solutions in place to help every person and organization on this planet to achieve more. And I'll be sharing 3 examples. One was the work we did in Haiti, where there was a total breakdown in telecommunications. And so this was the first time that Microsoft deployed something called the RDK. Have you heard of a Rapid Deployment Kit? So some of you have, right? It's essentially a satellite dish. But the satellite dish typically would fit into 8 suitcases, and you would need several engineers to assemble that. And the weight of that would make it prohibitive to bring in a lot of those satellite dishes into a disaster area. The RDK fits into 2 suitcases and can be deployed in less than 2 hours. And the way it works is that it's actually a big balloon. And within the balloon, a parabola is formed because there's there's a high pressure area on the upper half of the balloon and a low pressure area on the lower half. Therefore, within the balloon, a parabola is formed. And so this fits into 2 suitcases. It's not rigid, unlike the traditional dish. And so it's very easy to carry, it's light, and quick to deploy. So we deployed that for the first time in Haiti. But one of the problems that we observed was that, once you set up one of those kits, then of course everyone tends to flock to that area because then they'd like to avail of that communication facility. And many of them would, even if they were just a few kilometers away from the facility, it would take hours to get to the facility and then hours again to walk back, even if they were just 2 to 3 kilometers away. So when a similar tragedy happened in the Philippines, and this was Typhoon Yolanda, also known as Super Typhoon Haiyan, we brought in the same rapid development kits. We brought in 3 initially with through our partner NetHope. But we also had an additional weapon in our arsenal, which was what we call the TVWS, another acronym, TV White Space. I don't know how many of you have heard of this. Okay, so TV White Space gives you the ability to throw a signal, a broadband signal out 10, sometimes even 20 kilometers, because it uses the white space in between active television channels. Not that there were any active channels at Tacloban at that time, right? It was basically no one was broadcasting, but the technology was developed by Microsoft Research 10 years ago to take advantage of this white space. And so we took that technology, we brought TV white space radios to the island of Leyte. By the way, in partnership with our Department of Science and Technology, Undersecretary Casambre is over here. They helped with the deployment. And so this then allowed us to throw out the signal to evacuation centers so that people would not have to trek, and walk long distances. And then the third type of technology that we've had success with, and this happened in Nepal, is the use of what we like to call Skype phones. So basically, they're just phones equipped with Wi-Fi. And in the first few days of the Nepal disaster, when a lot of people were in evacuation camps and they had no way of informing their relatives, their friends, what their condition was, we assembled a group of Microsoft student volunteers, and we equipped them with, each of them at the beginning of the day had a fully charged Skype phone, and then they would go to the evacuation camps. And again, using the connection to the internet through Wi-Fi, they were able to help hundreds of Nepalese. They would just go around basically saying, have you gotten in touch with your family, or would you like to make an international call? And so, again, hundreds of calls were made using those student volunteers and using the Skype phones. So those are just 3 examples of how, even in the toughest of times, that we can get technology to work and get that information flowing. Because it's so important, to be able to know where to send the commodities, what the situation on the ground is.
I hope you're all listening very carefully because Hurricane Joaquin is on its way to New York right now. Thank you all very much. I want to disaggregate a little bit and look at kind of crisis preparedness and response. Sort of looking at the 3 major components: the preparedness for it, the response in the event, and then in the aftermath. And I'm going to try to not ask you all to answer every question because we'll be here for the rest of the afternoon. But you know, as many of you have indicated, there's still, even with bringing new technology to the table, the communication balloon as an example, there's still trial and error associated with all of this. And at the outset, I spoke about the shortages still in funds, and so I don't want to overstate all of the you know, the amount of money that needs to be spent on technology in advance, because there are still very cost-effective and low-cost ways of achieving the results that you need. But I'm interested to know, considering that each of you, even if you're at a new innovative lab or you're the first person to hold a position, your institutions have been around for quite a long time, all of them, and are all learning from these things. As Eisenhower said, you know, once the bullets start to fly, plans are worthless, but planning is everything. And I think that that's what a lot of you are involved in every day. As far as preparedness is concerned, obviously we've got the areas where we know something is likely to happen, right? Where you're in an earthquake zone or an area that's very susceptible to hurricanes or flooding, so you can do a lot of simulation, a lot of modeling, and a lot of preparation. But also, you know, there's a lot of technology can be brought to bear, as you've already talked about, to signal that something is going to occur, right? Weather prediction, even earthquake and tsunami prediction, and clearly on political risk, looking at a potential war situation evolving. You know you're going to have a refugee crisis coming out of that of some sort. So I'm interested, Rosa, to what extent, you know, IRC is preparing, is using technology and has learned from the examples of the past to be better prepared before these events ever occur, therefore a more efficient deployment of resources.
Sure. So I support solely our economic programming, so I'll give you that lens of how we're going about preparedness, and it's a bit of a buzzword that the donors, you know, we kind of pander to that to an extent, but in terms of actually operationalizing, it's not actually relying on the technology. We're pre-positioning our relationships with private sector partners, in particular for digital payment providers and digital payment streams, or thinking through contingency plans of if-then. If we have the ability to send, let's say, prepaid ATM cards to an area because the infrastructure is already there in a time before crisis, great. If not, we then move to the next step. Okay, if we can't use prepaid ATM cards, we can do, you know, cash and envelopes or whatever it is, but we're doing that kind of planning with private sector partners who are fairly well-known financial service providers who've been doing this for many, many years, and they have the information that we can map out and look and see where our ATMs, you know, will the ATMs actually sustain a crisis, to what extent, you know, will infrastructure fail? We have to do all of that pre-positioning up front in terms of information because we're already operating in a lot of these countries. So we already have a good sense of kind of where things shift because the crises themselves are cyclical. But the part that's new for us is really pre-positioning the contracting so we can actually operate once the crisis happens, rather than going through procurement and figuring out who should we be working with. The relationships are already in place.
And Eric, you talked a lot about the experience that you had with on the Ebola front, and in particular, and obviously preparation for something that's moving very fast, and where there's a lot of fear on the ground once it happens. It seems that being prepared is really critical to getting a fast response and an effective response. You know, what have you guys picked up from the Ebola experience as you prepare for the next one, frankly?
Sure. So, yeah, I mean, on the ground during the crisis, trying to get ahead of the spread of the outbreak was super important, and making sure that we were getting messages to health facilities to let them know that, you know, what to do if someone walks in with the symptoms of Ebola, for example, or something that we, you know, were able to do in the immediate term. But in terms of the kind of more holistic sense of preparedness, I think a lot of Rosa said, I think really hits home in that, you know, the first two words of USAID's mission statement are "we partner." So I think it's apt that we're here at this summit focusing on partnership. And I think, you know, the communities that did best during the Ebola outbreak are the ones that had good relationships with organizations like those on this panel today, who were able to work with the communities to make sure that they knew what to do should the disease show up on their doorstep. And it's forming those relationships in between emergencies and building those relationships not only between, the U.S. government and foreign governments, the U.S. government and NGOs, private sector firms. We're committed to investing in these relationships so that when a crisis strikes, we have partners on the ground, we have people who we can lean on, and we're working with, partners to promote stability and resilience in between emergencies, and that's ultimately where a lot of the preparedness comes from. And when we look at the Ebola crisis, when we really step back and think about why were these 3 countries so hard hit, the tragic truth is these were fragile states. Look at a country like Liberia, the average household survives on about $2 per day. There's no electric grid to speak of. There's no telephone lines. But for every 5 Liberians, there's 3 active SIM cards. And so we can invest in digital infrastructure. We can, use and leverage, as was mentioned earlier, the multiplying effect of getting information to people in the right time using technology. And it's those kinds of things that we can do to prepare. And we can work with host country governments and private sector partners, including telecom companies, to make sure that there are policies in place and there are strategies in place for preparing for the eventuality of an emergency in any place. I mean, even if it's not in a place where we have cyclical emergencies like the Philippines with the risk of typhoons, but in places where we might not expect this. I mean, this is the first time that, to our knowledge at the time, that Ebola had broken out in West Africa, and it's with investments in private sector and investments in good governance and digital infrastructure that we were able to use those tools.
Thanks. So when disaster strikes, obviously, we see very quickly aid start to rush in, and aid workers, boots on the ground, money is rushing in, people are donating. But oftentimes there is very little understanding of the environment and the theater that you're going to be operating on, particularly your sort of first responder, frontline people parachuting in essentially to where the disaster has occurred. And they're somewhat detached from the local circumstances that generally prevail, the cultural norms, social norms, and the like, that to some degree can undercut the connection between the aid organization and workers and those who are ultimately going to be receiving that aid. So to what extent can technology actually help you on the ground understand, in other words, going back again to Ebola, when people were very fearful, staying home, not wanting to be exposed or even tested in some cases, and needing to force multiply by use of local people who understood each other, knew each other, and getting there, that technology can also help people very quickly get some situational awareness on the ground, particularly if they're not used to, say, Western medical procedures, in the event. How are you using that to help your guys out on the front line?
So I would say, first of all, I think that organizations like ours and the others that are on the panel here that do respond in emergencies, we're rarely dropping into a place that we don't have a context, don't have some experience, and don't have local partners. In our case, a core part of our work is an ongoing program to distribute donated medicines and medical supplies to partner hospitals, clinics, and health centers. That's just work that's going on every day. And what happens for us is, in a disaster setting, that's going to 50 or so countries every year. In a disaster setting, it's one of those countries more than likely. And we already have a partner. We have a hospital. We have a clinic that we've been working with. We know who they are. We have systems with them in place to share what we have available, what our manifest could be, what they need, and sign-offs to make sure we're sending the right things and we get it there. So we have a track record with these local organizations. So it's a little bit different than sort of the sort of classic idea of sort of parachuting into a place maybe you don't have experience with. And But so as I said in my opening comment, the key for us, a key problem, part of collaboration that's needed better is with among the international NGOs and the WHO and others who are working on this. We do really well with our local partners. They know us, we know them, we share information back and forth. Those things are in place before disaster hits. But in the case of Nepal is a good example. We had several hospitals and clinics we work with there on an ongoing basis. And after the earthquake, we were right there with them. But to get products into the country after the disaster, we had to get approvals from WHO and from the Ministry of Health, which is a good thing because they want to make sure that things that are coming in are appropriate. And the technology that's in use here is my staff member with a printout manifest going to the WHO office and trying to find the right person who can sign off on it, and then going to the MOH office and finding the right person who can sign off it, and then going to the Civil Aviation office in Nepal to get the right person to sign off on the same piece of paper. That's the technology that's sort of in use today to do the collaboration there. And this is my point about finding, this is not rocket science technology. This is actually fairly simple technology, use of good Microsoft tools that exist today to be able to share that information and collect it a little bit better and move that through. So we sent a number of aid shipments and one big airlift that we sent. It probably lost 2 days, I would say, which is critical right after an earthquake. It probably lost 2 days in just moving that piece of paper around to get the right kinds of sign-offs.
Richard?
Yeah, I love what you said about making sure that you had partners on the ground already and already being there in the communities. So our programs in Liberia were actually through USAID's Food for Peace program. So we did community nutrition programs. And so we actually had the trust in the communities that we operated in. So when we went there with prevention messages, and when the Ebola crisis hit, we immediately took the Ebola curriculum and put it into all of the programs and things that we were doing. So they actually trusted us, they knew us, and so we were able to get the messages out there. And if you talk to most of the experts, really the community mobilization piece was what helped to stop Ebola in its tracks there. And so that gets back to Eric's point about how you have to have that continual investment in those countries and in those communities to be able to protect yourself in the long run from these crises from happening. And so I think we saw Ebola actually come to the U.S. from something like this. So I think America did kind of wake up and think, maybe the investments that we are making in global development are making a difference because they're helping to head something off before it would even come to the American shores.
Thank you. So much of what we're hearing about now in philanthrocapitalism and so on and so forth is the sort of the return on the investment. And part of the return on the investment is the accountability for how the money is spent. A, that it's not getting siphoned off in some way, shape, or form, but B, that it's being spent, since it's finite, in the most effective way possible. And so in the aftermath of these events clearly is the accountability issue and the review so that you can prepare more efficiently for the next one. And clearly, from the U.S. government's perspective, as a major donor, that's got to be a critical issue. So how is that being incorporated into the advanced planning you're doing, but also the transparency and the accountability? I'd like to hear from Eric and Dondi on this.
Yeah, while my co-panelists are preparing their answers for that question, can I share my answer to the previous one?
No, go ahead. Yes.
Partnerships are really important. So like in the case of Nepal, it was good that we had a group of student volunteers. Typically in any country, Microsoft has a program called Youth Spark, where we identify top talent from universities and give them T-shirts and train them and so on. And so it was very easy to take these volunteers to go out into the evacuation camps with those phones. We also worked with the Nepal industry of ISPs. So the internet service providers actually said, for X number of days, they would not charge anyone for the use of the internet. And that's why all those Skype calls were able to go out for free. In the case of the Philippines, the Department of Science, again, was a major partner in deploying all of this technology. But there are also difficulties. It's not always that easy. As Michael said, sometimes getting the approval is what can slow things down. In the case of the Philippines, it was providential that we already had TV white space radios in the country. We were planning to use it for a different project, for the project called EcoFish, which you'll actually hear more about tomorrow, because it's one of the finalists for the P3 Impact Award. But those radios that were in the Philippines suddenly had to be diverted to a different location because the typhoon struck. And so all of the approvals had already been done. It's not like we had the foresight to bring the radios in because we knew a typhoon was going to happen, right? We were just fortunate in that sense. But now we're prepared, right? Now Undersecretary Casambre has put aside, 10 radios, 10 of these TV white space radios. We can deploy them, if and when needed. The difficulty is if we have to bring them into a country where the regulations have not yet been in place, or the regulator has not even been aware of the impact of this type of technology. Because TV white space is a disruptive technology, right? It can, some broadcasters, for example, might object to the deployment because they're afraid that there might be interference. But again, there are ways to get around that. And telcos, for example, might balk at bringing in this type of wireless technology, which utilizes spectrum that they would otherwise have used for. So in the case of the Nepal government, it did take a while to get the necessary approval. So we had 35 boxes sitting in an airport ready to be airlifted to Nepal, and took actually several weeks before we were able to fly that in. And partly also because you're struggling to prioritize what do we send to Nepal, right? I mean, you have several boxes of medicines, and then on one side you have radios and antennas, and so, people go, let's send the medicines first, and then the second airlift comes, and then there's food, and then there's radios and antennas. Let's send the food in, right? And so at some point, I guess there has to be some kind of new protocol that says that information and communications is just as important, because then it lets you know where to send those medicines and where to send the food.
Thank you. And on to the accountability issue, Eric.
Sure. So in the spirit of tech and innovation for disaster response, I should first say that the Ebola response in particular was innovative by necessity. I mean, we'd never done anything like that before. We'd never had to mobilize communicators across an entire country to teach an entire country about a disease on that kind of scale. We've never had to build, infectious treatment units all over a country on that kind of scale and with that kind of speed before. And so we had to use an innovative approach. I mean, we were using the best evidence that we had available to us to make decisions in real time and adapt those efforts to the changing landscape of the crisis response. And this is something that we are committed to learning from and trying to make sure that in future emergencies, whether they're natural disasters, conflict-driven, or other types of emergencies, including public health emergencies, we want to make sure that we're using lessons from that experience in West Africa to improve the way that we respond to future disasters. As far as accountability and transparency goes, I mean, one of the best tools that we can use to promote these principles is better information, and information that's open by default. And technology can help us do that. Technology helps us, as we're all kind of saying, improve the flow of information, not only from the field to the top, as I mentioned earlier, but also between parties who need that information on the ground. And for that, we need to make sure that we're doing a better job, or as good a job as we can, of making sure that the information that we're collecting and using is interoperable with everyone else's. And so this is the equivalent of agreeing before, between emergencies that, when an emergency strikes in my town, when you come in here, we're going to use radio channel 3, and that's what we're going to use to communicate. And we're promoting interoperability of information management through our work with the UN, for example, and a platform that we're using for that is the Humanitarian Data Exchange. And that's a platform that allows us to gather information from a handful of organizations, including some of the ones that are sitting up here today. And we're using this, for example, to make sure that we have a transparent and accountable system for training health workers in Guinea in terms of infection prevention preparedness. So making sure that every facility that needs to have had their health workers trained have had that training. And that's really promoted through better use of information. And one other thing that I'll say in terms of accountability, one of the best tools that we have at our disposal as far as technology goes for promoting this is moving away from cash and moving toward digital finance. And we are committed at USAID and the U.S. government to moving away from using cash in international development. We have we've started an initiative called the Better Than Cash Alliance, which includes a lot of the organizations that are here today and will be here tomorrow, which is really trying to promote the increased utilization of digital financial services across the board for the work that we do, which has incredible efficiency gains associated with it and has an incredible power to promote accountability in the way that we do our work.
I'd like to open it up to the floor, but before I do, is there anybody else who'd like to comment on the accountability front?
I'll piggyback off of, especially with this mention of cash. I think accountability from a organization that's receiving money, we're accountable to the people that we're serving. We're also very accountable to our donors. And we have to prove our value for money for anything that we're doing that's somehow innovative or new or kind of outside of the current boxes that we're thinking in. Cash is an interesting story for us, though, in that we understand the efficiency gains of digital payments. We're still getting donors to allow us to even do cash programming, even if it's hard cash. And so we're still accountable, even though this is what our beneficiaries or clients are saying that they want, we're still accountable to our donors first and foremost to even convince them to allow us to do that form of programming. Then, sure, we can look at the digital payments, but that's a bit of we're playing this middle ground of having to, from the top, policy-wise, advocacy, pushing for just the general idea of cash versus also being accountable to our beneficiaries and giving them cash assistance rather than in-kind aid.
If I could just make one quick comment, just to amplify something I said in my opening comments, and I'm going to lean a little bit into your marketing space for this one, if you don't mind. But I mentioned that in the issue of transparency, there is accountability to donors, but I think there's also, especially on the private donor side, the idea of the use of technology to inspire donors to be involved, to open their wallets, to provide resources. And I think there are technologies, whether it's social media or other kinds of things, that can be better used to connect people who might be willing to support disaster response work to that disaster response work by helping them feel closer and better connected and almost touching that in a way that they couldn't. And there's a little bit of a marketing spin to that, but it's important because when people respond in a big way to a disaster, a lot of private resources can be well used by organizations like ours to do good work.
Just one quick thing on the cash conversation, just because it's such a hot topic, I think, right now in global development. But I think it's something that's really critical for women's empowerment programs. So we do a lot with women's empowerment programs around the world. We have over 500,000 women that are involved in small village micro-savings and loan groups with us, and to be able to have them to do mobile banking as opposed to having cash is just such an issue of safety for them to be able to do it, because when they have a lot of cash, a lot of times they're forced with robbery, there's violence and things with it. So if they can do things through a mobile banking system, it's much easier to do and it's much safer for them. And we've done a lot of that in India with programs where women can actually apply for loans online through a partnership that we have with Qualcomm. And so it's just a direction that we need to move in more.
Great, thank you very much. Are there any questions from the audience? Yes, ma'am.
I'm curious, given that the topic is partly technology, how you deal with the issue of energy, particularly both to power and just for lighting and cooling medicines, for example. In a number of these situations where, in many situations, the grid just simply doesn't exist. Liberia, I think, has a 6% electrification rate, or where the grid or other forms of electricity have been destroyed because of the nature of the tragedy that's happened. So I'm just curious how you deal with that. And I'm Nikki Armakos with Art Finance.
Who'd like to take it?
Maybe we didn't address it because it's the big limiting factor.
Well, okay, so let me just jump in and say that, yeah, a lot of the communications technologies that I mentioned will run off of solar power cells, right? So that would be, in fact, that was the first solution that we deployed in Tacloban after the typhoon. But then, typically we would have generators as well. So that would be the second line is once you've been able to, bring in enough of the equipment, bring in the fuel, then we would use it. So that's how we did it, at least in the case of the Philippines.
If I could just give a quick example from the Philippines, after Haiyan in the Tacloban area, part of our post-emergency recovery work was helping rebuild about 50 health centers that were damaged. And going to the idea of preparedness, we were thinking about this very issue. And so we were able to outfit a number of those clinics for the first time with generators. Then when the next typhoon came through the area about a year later and all the power was gone, one of those clinics that we had outfitted with a generator was up and running through the whole thing and delivered several babies that night of the typhoon because they were able to operate. So some of that is just thinking about that very limitation and how do we solve it. Again, it's not, whether it's generators or solar cells or something, but we have to solve that one.
Any other questions? I would like to ask, considering that we're in the middle of the UNGA week, that next year the Secretary General of the United Nations is going to be convening the World Humanitarian Summit, and one of the key mandates of that is to overhaul the crisis response agenda. You've talked about a lot of innovation and a lot of things that you're doing either individually or speaking on behalf of the aid world. But what do you think is going to come out of that? And is it really going to advance things, or are we still going to rest on the tried and true? Rosa? You're laughing.
Well, one of our projects now is actually the pinnacle of it is releasing the information and everything at the World Humanitarian Summit. So I'm grimacing a bit that it's coming a lot sooner than we're hoping. But nevertheless, I think it's allowing a stage for us. Using IRC as an example, we're for the next year and a half, or for the past year, and now for the next year, we're working towards internally changing the way that we're thinking about how we deliver aid. By shifting to cash programming first and foremost, and asking the question, why cash? Why not cash? So that for us is it's a behavior change. We're changing our philosophy internally, and I think we would have gotten there, but having forums like the World Humanitarian Summit are good. Basically, they're good excuses that nudge people in that direction and force you to really take a moment of reflection and say, we don't have to keep doing things as status quo. We can look internally and change the way that we're doing things and perhaps lead by example. So I see that it's allowing us to kind of uncover within other organizations who else is doing that, and we'll be able to share lessons learned and go from there.
Eric?
Sure. I think we've talked a little bit about the changing kind of landscape of crisis response in terms of the crises themselves, but also we'd be remiss not to talk about how the landscape in terms of who's at the table, who are the responders who are acting during a crisis, and I think if we look back 20 years ago, most of the money flowing into developing countries was from government donors like USAID. Today, 91% of that capital is private, flowing into emerging markets, and the numbers are not quite as drastic yet for humanitarian response, but we're getting there, and we know as we see increasing involvement from private sector partners and other non-traditional organizations for humanitarian response, that we are not only facing a changing landscape of the crises themselves, but of who's coming to the table. And that's a tremendous opportunity. And I think having open conversations like the forum for the World Humanitarian Summit are fantastic ways to do that, but also this room. You know, getting us together in between emergencies to talk about the kinds of things that we can do to be better prepared and to invest in these places so that they're more resilient, and to, you know, promote the use of technology and innovation for more adaptive approaches to crisis response is absolutely what we should be doing. And we should be doing it openly, we should be doing it all the time.
Sorry, I had a question. Sure. I'm also curious, sort of bringing the lessons that you guys seem to have had over the previous disasters and conflicts, but how are you using that learning and applying it to current crises, like the refugee crisis that's happening now? Are there examples from your organizations? I'm really just curious. And are you applying those lessons now?
I would say that the different kinds of crises create different kinds of lessons, right? So I think probably the thing that has been most unique, just going to a couple of your points before about the most recently is the Ebola crisis and the lessons learned there about strengthening health systems. I think is one of the critical lessons there. If you think about preparedness as a general idea, but you think about just general development of countries, the need to better prepare health systems to deal with ongoing work, but also with crises that might come in. So as we think about our overall work, we're thinking about strengthening local health systems, and when we put a disaster response lens on that, we're thinking about how do we make them more resilient, how do we work with health workers in Nepal going forward to help them be prepared for the next time that an earthquake strikes there, both personally prepared for it, but also their facilities, their equipment, their policies, their procedures, all of that. So, for us, I think that general idea of the strengthening of local health systems, because we're a health-focused organization, is a lesson being drawn out of both Ebola and some of the other natural disasters.
Thank you. I know there were a couple more questions. If I could ask you to come up and speak to the panelists here at the end. My one job is to keep this thing on the show on the road here. And so with that, I want to ask you to thank our panelists. They were great. Thank you very much.